Your grandmother is fine. That's what the doctors said. That's what the family keeps saying. She's tired. She's slowing down, but she's fine. The dog disagrees. It won't leave her bedroom. 3 days now. Not barking, not playing, barely eating, just sitting outside her door, waiting. You told yourself it was nothing. Animals do strange things. But there's a category of research, published in the most respected medical journals in the world, that suggests your dog wasn't being strange. It was detecting something. Something your doctors couldn't measure yet. Something you couldn't see. And here's what makes that uncomfortable. You may have been right. When a body begins to shut down, it doesn't announce itself. Not to us. Not immediately. But the chemistry changes. Long before any visible symptom appears, something shifts at the molecular level. Ketones rise. Dimethyl sulfide increases. Specific proteins in the breath change concentration. The smell of a dying body, long before any doctor would recognize the signs, is different. Not dramatically, not in a way you would notice, but dogs have 300 million scent receptors. You have 6 million. The part of a dog's brain dedicated to analyzing smell is proportionally 40 times larger than yours. They are not smelling what you smell. They are reading a chemical story you don't have the equipment to access. And that story, the chemistry of a body beginning to fail, has a very specific signature, one they can identify, one they respond to. In 2007, a paper was published in the New England Journal of Medicine, the most prestigious medical journal in the world. The subject was a cat. His name was Oscar. Oscar lived at the Steere House Nursing and Rehabilitation Center in Providence, Rhode Island. He was not a friendly cat. Staff described him as aloof, standoffish, indifferent to most residents. He didn't like to be held. He didn't seek affection. By every account, a difficult animal to like. But Oscar had a habit. When a resident was going to die, not was sick, not was declining, was going to die within the next 4 hours, Oscar would find them, walk into their room, jump onto their bed, curl up beside them, and stay. He would not leave until they were gone. Here's where it gets genuinely strange. In over 100 documented cases, Oscar was wrong twice. Medical staff began using him as a diagnostic tool. When Oscar walked into a room and settled on a bed, they called the family. Not if, not maybe, they called. Because Oscar was more accurate than their clinical assessments. More accurate than heart rate monitors. More accurate than nursing staff with decades of experience. A cat, deciding who was about to die, and being right. Oscar isn't alone. Dogs working in hospice settings show the same behavior. They gravitate toward specific patients, not the sickest patients, the ones closest to the end. There's a difference. Sickness and dying have different chemical signatures. Dogs track the dying signature specifically. In 2011, researchers at the University of Vienna documented therapy dogs alerting terminally ill patients up to 24 hours before death, in cases where medical staff had not yet recognized the decline. Elephants have been observed returning to the bones of their dead for years, standing over them, touching them with their trunks, remaining still. They don't just sense dying, they remember it. Some researchers believe elephants hold something so close to grief that the difference becomes a philosophical question, not a scientific one. Here's where it stops being comfortable. The chemical explanation covers some of it. Ketones, dimethyl sulfide, bacterial compounds beginning to form at the cellular level before any organ failure is visible. That's the mechanical answer. But some of the documented cases don't fit. Oscar would sometimes walk past rooms where residents were genuinely critical, medically, the sicker patient, and go instead to a room where the patient seemed stable. That patient would die within hours. The critical patient would recover. The chemistry should have pointed to the sicker room. It didn't, which means Oscar was reading something beyond chemistry, something science hasn't named yet. Do they understand death the way you understand it? No, almost certainly not. They don't have a concept of mortality. They don't lie awake thinking about their own end. They don't grieve the abstract idea of loss, but they perceive the process. They detect the biology of ending, and something in how they respond to it looks remarkably like understanding. Oscar didn't run from death. He walked toward it, chose to be present for it, every single time. Instinct runs from dying. Predators avoid dying animals. It is a biological rule written into almost every creature on Earth. Oscar broke that rule, over and over, for 17 years, and nobody trained him to. Oscar died in 2022. He was 17 years old. In his life at Steere House, he sat with over 100 residents in their final hours. He was not asked to do this. He was not trained to do this. He received no reward. The residents he chose were often unconscious, non-responsive, unable to acknowledge him. He sat with them anyway. When his own health declined in his final months, the staff noticed something. Oscar began spending more time alone, sitting in quiet corners of the ward, away from the noise, away from the activity. The nurses who had watched him for 17 years said it was the first time he had ever seemed to need the kind of stillness he had always provided for others. He died quietly, in a corner he had chosen himself, and the 100 people he had sat with had not died alone, because of him. A cat who didn't like people, who kept showing up anyway.